Hello, welcome to my channel. You probably remember this horse from a previous video on the mechanism of pain. If you missed it, you can find it at the link that appears on top. In this video, I will speak about pain management, and it was requested by Kare Garal in a comment. If you remember from the previous video, nociceptive pain is caused by activation of high threshold A delta and C fibers. The most effective method to control this type of pain is to interrupt neurotransmission near to the site of injury with the use of local or regional blocks, using sodium channel blockers. Nociceptive pain can also be modulated with alpha-2 agonists and opioids. Alpha-2 agonists decrease afferent activity and activate descending inhibitory neurons. Opioids decrease A delta and C fibers neurotransmitter release and result in hyperpolarization and reduced responsiveness of neurons. General anesthetics are also effective in controlling nociceptive pain, as they cause unconsciousness. Inflammatory pain is caused by activation of pain receptors by inflammatory cells and mediators. Despite the changes induced by inflammation, neurotransmission can still be effectively interrupted by local anesthetics. Furthermore, opioids, due to their analgesic effect, are good options for the treatment of inflammatory pain. But obviously, to block the vicious circle of inflammation, the most effective drugs are anti-inflammatories. Non-steroidal anti-inflammatory drugs produce pain relief by blocking the generation of pro-inflammatory and pro-analgesic substances. The soluble epoxide hydrolases are enzymes that mediate another pathway of arachidonic acid metabolism, and the inhibition of these enzymes produce anti-nociception in both peripheral and central nervous systems. Also, omega-3 are included in this mechanism of pain modulation because they direct the metabolism of arachidonic acid through less inflammatory compounds. Neuropathic pain, if you remember, occurs after injury to peripheral or central nervous systems neurons, secondary to trauma or chronic inflammatory diseases. Head shaking, laminitis, and arthritis are examples of neuropathic pain. This type of pain is therefore more difficult to treat, also because the pathophysiological mechanism at its basis is not completely clear. Multimodal analgesic strategies are probably more effective than single-modality therapy. Also, physical agents used to manipulate the temperature, ice and heat, magnetic fields, compression and movement have been recommended as part of equine rehabilitation therapy. Extremely important, and not to underestimate, is a good nursing care and adequate welfare, as anxiety and stress can enhance pain perception, as we discussed in the video on behavior. Okay, this was the last video of the year, so I wish you a happy new year, and we will continue to speak about equine medicine in 2021. Bye!